Hey, how's it going, guys? Saman here from All Things PT, and in this video we're going to go over gluteal tendinopathy, find out if you have gluteal tendinopathy and see how you can fix it. Gluteal tendinopathy was once diagnosed as hip bursitis. Basically what it is that there is a bursa underneath the muscle, and people used to think that that bursa would get inflamed, causing pain right here. However, many studies have shown that it's not the bursa that actually causes the pain, but it's actually overloading of the tendon of the glutes, specifically glute max and glute med, that's causing pain. So, what are the chances you have a gluteal tendinopathy? First of all, you'll have pain on the lateral side of the hip, that's right here. Second, you may have just overtrained yourself. So if you are somebody that was, say, not used to hiking a whole lot, and then you hiked like 15 miles all of a sudden, or if you went from training 2 days a week to 7 days a week, or there has to be some size of overtraining or overactivity that your body is not used to. You will also have pain when you're going up or down the stairs or walking or even standing on a single leg like this, where say my left hip is affected and trying to stand like this creates pain. So this is how you know you have a gluteal tendinopathy. There is also another test that you could do where you basically lie down on your back. Say for this case my left hip is the affected side. You lie down on my back, on your side, you are going to extend your hip like this. You're going to bend your knee, you're going to externally rotate your ankle up like this, and if this provokes your familiar pain, chances are you also have gluteal tendinopathy. So there are 4 or 5 things that I just told you, your signs and symptoms, what may cause a gluteal tendinopathy. So I'm going to make this video very, very simple. I'm only going to give you about 5 or 6 exercises that is with progression that will help you treat this gluteal tendinopathy. I have been very, very successful treating my patients with gluteal tendinopathy with just these simple exercises, so make sure you do them. So you don't need much of an equipment, but if you need a band like this, and you can use a ball, which I'm going to show you in a second. But other than that, you don't need much. Sorry, I forgot. You also need another band, and so this band is from Hip Circle, but you don't need anything like this. You can use a belt that you use on your pants if you don't have this, and I will show you the exercise with this in a second as well. But anyways, so we're going to target both glute med and glute max for this. And so for the first exercise, the first stage I should say, is when you should do these exercises during where your pain is high and your hip is very sensitive. Okay, so you're going to lie down on your back. This is going to be stage 1, super easy. You're going to lie down flat on your back, and all you're going to do is you're going to squeeze the butt. You are going to hold this position with the butt squeeze for about 5 seconds, and you're going to relax. You're going to squeeze it again, hold for 5, and relax. So you are going to do this for about 10 repetitions. So that's for your glute max. Now for your glute med, that's when you're going to use this band right here. You're going to put it around, or you're going to use a belt, and all you're going to do, you're going to push to the side. You're going to feel the side of the hip muscle working right here. This should be on fire. Same thing. Hold for 5 seconds and relax. Push, hold for 5 seconds and relax. Again, if you don't have these bands like that, we can put a regular belt, but it should be something very sturdy. It shouldn't be flimsy like this one. Okay, you do this when your hip pain is pretty high. So you're doing this isometrically. Hold for 5 and relax. Yeah. So that's stage 1. That's it, right? For the butt squeeze, if you are starting to have any kind of back pain when you are squeezing your butt like this, you can also do it on your stomach, where you are putting your head down, okay, like this. Then you can squeeze this one. like this. You can put a pillow underneath if that helps. Squeeze, hold for 5 seconds, and then relax. Just 10 repetitions of those, okay? And so during the initial stage when your hip is irritated, you don't want to do a whole lot of repetition, a whole lot of exercise. But what I have found successful with myself and patients during at least this phase is that I do 10 repetition of the butt squeezes, 10 repetition of the hip abduction. And then, but I do it about 5 times a day, okay? 5 times. Now, I get it that a lot of people are working, and then you may not have time to do our situation where you can lie down and do it 5 times a day. In those cases, what I would say, you can kind of mimic that exercise when you are standing. You can do the same thing when you are squeezing your butt, holding for 5 seconds, and then relax. Squeezing your butt, holding for 5 seconds, and relax. Now, for the hip abduction exercise, what you could do, say you have a sitting job, or you can find a place to sit. It's pretty easy. You're going to use your hands as resistance. You're going to put it on the side, and you're going to push your knee out in that direction while your hand holds it. So you're mimicking whatever you're doing on the ground. Now, doing on the ground is better, okay? But because a lot of people can't lie down 5 times a day because they're working, I think this is a great substitute. So you're going to put your hands like this, and you're going to push out. You're going to hold for 5 seconds. Feel this side of the hip muscle working, and hold for 5 seconds and relax. So again, push out, feel that side hip muscle working, and relax. Push out, squeeze that, hold for 5, relax. And you should be feeling the same muscle outside of the hip working, okay? So do that as a substitution. After a few days, when this becomes a lot easier, that's when you want to progress. So what you want to do, now we don't need the belt. What you want to do, I'll show this to you in a second. Let me put this guy right here. Okay. You are going to go down, and then you are going to bend your knees. You're going to squeeze your butt and lift up. And you are going to hold for 5 seconds, really focusing on the butt right here. Your back shouldn't be hurting. Your hamstring shouldn't be cramping. You just should be feeling on your butt. Now, what I have found with patients is because a lot of people that have gluteal tendinopathy, they don't know how to activate their butt. When you do the bridge, you're going to feel it on your back or your hamstrings more than your butt. So doing it on a ball like this, you can do it on a couch where you say, this is the couch and you're putting your leg up, is going to help. So you're going to do the same exercise where you're squeezing your butt and lifting yourself up, and you're holding. Now this one is really going to help you isolate the butt much more than your hamstrings. Same thing, hold for 5 and relax. Hold for 5 and relax. Hold for 5 and then relax. Okay? Then that was for your glute max, and for glute med, now you are going to put this band. You can do it without the band. You can start without the band, and then as you get better, you can add the band. But you're going to go on your side like this, and then make sure your back is straight, and you are going to lift your knee up like this. Okay? Hold for 5 and relax. 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 One thing that I see a lot of patients do when you do this exercise is they try to go as high as they can, and in the process they will twist their back like this. And we don't want to do that. We just want to feel this part of the hip moving and not our back rotating. Okay, again, the key is holding for 5 seconds. You should feel this muscle really working hard. You can obviously do it for more reps or you can increase the intensity of the band to make the exercise more challenging. You are going to do this about one set of 10 to 15 repetition about 3 times a day. 3 times, okay? So before, on stage 1, it was 5 times a day. Stage 2, the exercises are difficult, so we are only doing it 3 times a day. Just one set. Again, the key is not to load the hip so much in one session, but kind of spread it throughout so that your tendons don't get loaded too much at once. Okay? So 3 times a day. Now, if you can do it morning, you can do it right before bed. If you don't have time to lie down at office or whatever, you can always do the stage 1 exercise and contract harder. Maybe instead of holding for 5 seconds, you can hold it for 10 seconds, stuff like that. Or you can do 2 sets in the morning and 2 sets at night, or vice versa. But I wouldn't do it too much. It's just going to piss off the hip, okay? Now, let's go to the stage 3 of exercise, where you are going to do it standing. The final stage, obviously, is the most difficult stage. This is where most of the healing happens. But please do not jump in to stage 3 without at least doing stage 1 and 2 for a few days. The stage 1 and 2 are kind of building the base for your body for you to do stage 3. It will help you kind of feel the muscle and use the muscle accurately, okay? So please, please, please do not do stage 3 exercises without doing stage 1 and 2. Stage 3, the first exercise you're going to do is a squat. Okay, and so if you can see, I have my bench right behind me. This is to control range of motion. If you don't have a bench, obviously you can do it on a chair or something. But now you're going to start focusing on eccentric. You're going to do a sit to stand or a squat at 90 degrees or so. You're going to stand straight. Your feet shoulder width apart, slightly outside. You can feel free to change the position and see what's more comfortable to you. At this phase, it should be very comfortable for you to do these exercises. Stand back. You're going to hinge at your hip, squat down. Once you touch the chair, you're going to stand up. Okay? And as you stand up, squeeze your butt. Okay, again, hinge back. Squeeze your butt as you stand up. After a day or 2 of doing just these exercises, nice and slow, I want you to start focusing on the eccentric, where going down should be about 5 seconds or so, and coming up kind of be a little explosive, okay? So 1001, 1002, 1002, 3, 1004, 1005, squeeze your butt, okay? I'm just going to do it now. Okay? Make sure that your body weight is right at the middle. If you put it too back, if you put your body weight behind on your heels, you're going to kind of tilt back. And if your body weight is right here at the front, you're going to tilt forward. So make sure it's at the center as you squat and squeeze up, okay? So, obviously, if you have your squat rack, you can really do your regular squats. If you don't have it, grab yourself a couple of weights, backpack, whatever you can find, and then you can make this exercise more challenging. So I'm going to grab myself a kettlebell, and then I do the same exercise, squeeze. Don't forget to squeeze the butt as you come up, okay? Good. So that was your squat progression for glute max. Once you can do 90 degrees, you can load it a little bit with weight. Then I would kind of progress to obviously a full body squat. Okay? Again, focus on eccentric and then explode on the way up, squeeze your butt. Just focus on a good form first before you start adding weight. And once you feel like you can go deep comfortably, feel free to add weight. Now for the glute med version. Glute med, one of the most important functions of the glute med is to stabilize your hip. So basically, on my left right now, as I'm balancing, my glute med has to work hard so that the hip doesn't drop. Okay, so the exercises we do is going to mimic it. So you're going to get that band. It's okay if you don't have band. Let me actually do it without the band first. So right now, what you are going to do, I'm going to show you from the side. You're going to stand on one leg. In this case, I would say my left side is the affected side. You're going to hinge back just a tad, make sure your posture is pretty good. And you are just going to do standing fire hydrants. Okay, so now this hip is moving into abduction, so this glute med is working. But this glute is also working for balance. Okay, so again, let me show you from this side again. You're going to be right here, hinge through your hip. Okay, so same thing from the front, hinge through your hip. You should be really feeling both the glutes firing. Once you are ready, and once you can do this comfortably, I should say, then you can progress by adding some resistance. So same thing, hinge. Again, as you are maintaining balance, make sure you're squeezing the butt. Obviously, you do it on both sides, right? Because then you are working on the stability portion of the glute med, and you are working on the mobility portion of your glute med. So, we work on 3 stages of gluteal tendinopathy. Stage 1, very easy, lying down on your back. 10 repetitions, 5-second hold for both exercises. I gave you standing variations of stage 1 because you got to do them 5 times a day. Stage 2, 2 exercises again, 3 times a day for again 10 repetition, hold for 5 seconds. Now stage 3, the most difficult one, you're actually only going to do it 4 times a week. That's it. Okay? 4 times a week. If you want, you can do 5 times a week. But I want you to challenge yourself on this one a little bit. And you also need a day or 2 off in between so that you don't overload your tendons. Okay? But eventually, I want you to have progressively overload those muscles so that it will get stronger. So I think doing 1 to 2 sets 4 days a week is going to be more than enough. Okay? Now, if this doesn't help you, if your pain is right there on your sit bones, okay? If your pain is right in this line, okay? If your pain is right there on the groin, if there are shooting pains down the leg, you may have something else. You may have hip impingement if the pain is right there by the groin. If your muscle hurts right there on your sit bones, you may have a hamstring strain. If you have your pain right here, you may have a SI joint dysfunction. Usually with gluteal tendinopathy, the pain is on the lateral side, right here, okay? So you gotta make sure that you don't have these. But even then, a lot of those exercises I showed you will kind of start with the same progression. So even if you did have other condition, doing these exercises are definitely going to be very helpful, okay? All right. Hopefully this video helped. If it did, please make sure you click the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.